Okay, today I have the honor of speaking to Bryan Cush, and Bryan is a friend and an expert in anything healthcare marketing. Bryan, welcome. So good to have you here.
Yeah, it's awesome to be here, Ani. This is going to be a fun conversation.
Okay, so I just want to say briefly how you and I met. We both belong to an organization called Entrepreneurs Organization, and we have a monthly call where we get together with a bunch of healthcare entrepreneurs. And you were in that group, and we connected after. And when we started talking, I realized that you had something of really great value to share with our audience, the people that follow us. And marketing is always something that most physicians and most large practices do not do, and they rely heavily on word of mouth. And so I'm really excited to have this conversation with you and educate us about what is healthcare marketing, and I'll let you take it away.
Yeah, what I love about too is our shared New York footprint. That really where we cut our teeth was partnerships with billing companies, and I think this whole conversation will really uncover how we think about the data they have access to, and how it helps us, and how it helps the practices and their end clients.
Awesome. Yes. Love that we're both New Yorkers, for sure.
Except it's like 104 degrees right now. The Manhattan sidewalks are roasting.
Okay, well, it's good that you're inside and doing this webinar instead of out there. Okay, you take it away. I'm gonna let you I'm gonna hide myself here. Go ahead.
Sounds good. Well, I appreciate everyone joining. We get this question a lot, and this question kind of like many different ways, where we're calling it when it's appropriate to start an ad campaign, but it can be asked in a lot of different ways. Where really like, what's the appropriate budget? Like, what are the things that we should be doing? And a lot of what I'm going to talk about today really is outside of the ad campaigns themselves, where I think there's a lot of conversation, especially within the marketing world, on like how to use Google Ads, how to use Facebook ads within the platform itself. But I'm trying to really peel back a different perspective of how do we use the data, especially within healthcare, to inform and make better decisions around these ad platforms. That's a little bit of just the agenda today, where we did kind of a brief introduction, and I'll give a little bit more of my background, kind of why you should even be listening to me about this topic in particular. A little bit of the landscape around paid ads. I think people know most of the kind of like 800-pound gorillas in the rooms, but understand the difference between the platforms themselves. Preparation. I mean, that's probably going to be the biggest thing we talk about around what data can we use? What are all the things that need to be in place to answer that question of when is it appropriate to start an ad campaign? Timing. We get that a lot too. It could be as granular as time of day, time of week, time of season. How to think about that from a healthcare perspective, really how to think about that from a consumer's perspective. And I use that word very intentionally, that people within healthcare are still consumers. And I think that's kind of overlooked often, that people do research, people make comparisons, people look up reviews just like anything else they consume, that healthcare is not different from that. We review a lot of what we walk through, hopefully some takeaways that the audience and listeners can move on to put into use and practice if we have any questions, and then a few things that hopefully we can take advantage of as well. Kind of gave her introduction to herself and myself as well. One of the things I like to call out about myself and really our firm's background is, I made a kind of comment about the New York relationship, but that's really where we cut our teeth, was in New York. And it's probably one of the most dense, kind of like competitive, hyper specialized medical markets probably in the world. And in particular, I'm going to walk through a couple of different examples that even reference in network versus out of network healthcare. And I think you'll probably get shocked throughout this of how much I'm talking about things that are non-marketing and heavily around insurance and even coding. And the main reason why is that as marketers, we really look at the data within medical billing as something that we can leverage, not only in understanding the financial implication of how to measure an ad account, but there's a slew of data, especially around plans, plan benefits, in and out of network benefits, CPT codes, ICD codes that can come backwards and leverage and make the advertising campaign smarter. A little bit of an overview from just kind of the paid ads landscape. We're definitely zooming in heavily on digital in this conversation too, not dismissing. We work with and have some great advertising partners with like out of home and all those things. The ability to track becomes a different conversation. And for kind of the intentions of this conversation, we're going to zoom in even further really onto Google and what we call intent-based marketing. But I always like to kind of lay out the kind of two core competencies within digital ads landscapes and why we're zooming in on Google in particular. That when someone searches something, we have a much better understanding of their intention. And you can see in kind of all these populated terms here, when someone inserts different words, we can really infer whether they're then looking for physical care or a doctor, or they're kind of further down that funnel that they already are potentially diagnosed or looking for a diagnosis. That becomes a lot more powerful of a scenario than just doing something that's demographic. And the easiest way to think about that is, I think almost everyone is on Facebook in some sense. You don't use Facebook as a search tool. So the only thing that you can really target by someone is the information that you have in your profile or the things you interact with. So demographic-based marketing has a tremendous use. It's often more than brand play. So for today's call, we're going to kind of dig a lot further into the Google side because we can match intent and you really start to understand how that can be drawn in straight lines to the concepts of things like CPT codes and ICD codes as well. I referenced it kind of early on, but Google is the 800-pound gorilla in the room. Just to draw a strong visual on what we say from Google, and particularly Google Ads on the right-hand side, you can see when you search something, if an advertiser thinks that your intent is of value to them, they're going to purchase that term, and then the little box where it says AD ad will populate in that search result. Roughly, and this number moves a bit, but their market share is tremendous. I mean, that's the basic principle of why we're talking about Google is they own the market share. It fluctuates definitely kind of market to market and even country to country, but it's double digits. It's always double digits plus, like 80 to 90% of search within Google. The thing that's even more, I think, interesting to this call is that healthcare is actually the largest category of search, where 7% you may look at and go, okay, that means there's 93 other percent of types of search, but it's actually the largest category. 7% is the kind of moving number of the amount of search online that is health related. So we get that question a lot too of like, well, is there even reason for me to start an ad campaign? Or how do I compete against like kind of the other gorillas in the room from a healthcare perspective, like Cleveland Clinic and Mayo Clinic, when they own a lot of organic? And the way we explain it is that is billions and billions of searches each year that are constantly evolving, and they're constantly newer searches than today than there was yesterday. And the easiest way we explained it was COVID. Like COVID was that kind of big black swan event that it was every single medical specialty and the word COVID. People were like just thirsting for information that didn't exist before. So we saw a lot of, especially our more nimble clients, be able to produce information and kind of get ahead of some of those more kind of stalwart institutions. So there's always opportunity when there's just that much volume of billions of searches to kind of carve out your own niche, especially if you're a local provider and you have brick and mortar as well. There's always room to kind of carve out exactly the type of patient you're looking for. Another area to dig in a little bit on the landscape is now we understand the kind of breadth and size of the billions and billions of healthcare searches online, is how do we start to then categorize them? And this is an image from a study probably almost about a decade ago now. That was a white paper from Google actually that came out, and they categorized hundreds of billions of healthcare searches. They broke them down into these 4 categories. And there's a lot that can be learned from this, and we still bring this up almost every conversation we have 10 years later, is that it's very, very common when we start with a brand or a practice or a hospital even, that they're often playing in that branded and treatment world. Simply put, is people know how to find you by your name, and people know how to find you by the very clinical terminology of what you do, i.e. treatments and procedures. But ultimately, that is a much, much smaller playground based of all the healthcare search that's online. So this number fluctuates and it even grows because of things like COVID, that upwards of 70 to 80% of healthcare search is symptoms and conditions. Simply put, it's the layman things that people are searching for that they don't know what they've been diagnosed with yet. They don't know what procedure they need, and they definitely don't know what doctor or brand to see. So it's a funny thing, and it's kind of a little jarring, especially when you talk to doctors, to go, okay, people don't always know who you are. So we really need to associate what you do, particularly in the layman terminologies, to who you are, and then bring that authority down. If you're only playing kind of that smaller playground, you're really just missing the bigger pie. And it's a hard thing a lot of times when you talk to healthcare brands for them to swallow. But I think as you think about it from a consumer's perspective, it makes sense. Most of us just know exactly what it is that we're suffering from, or what is it that they're limiting our day to day. We don't know what we have yet. We definitely don't know what we need to get treated with yet. And we definitely don't know who the brand is to go to. So you really want to make sure you're always thinking much larger than just kind of the what we call business of healthcare language. So one of the biggest things around preparation that I think, especially in healthcare, that is difficult is it's not a dollars and cents transaction at the moment of inquiry. We always say that this is not e-commerce. Like e-commerce is a much simpler transaction to track because at the point of purchase is a dollars and cents transaction. We can exclude things like cash pay and concierge and things like that, where we can argue, but the primary bulk of healthcare is insurance based. You may be in network and kind of have a contracted rate, but then you could be out of network, not have a contracted rate. And we really think about the data as billers or billing companies really is a gold mine to inform not only their clients, but then bring that to other partners, especially advertisers and marketing agencies, that very often we come across scenarios where even when they're in network, they'll go, okay, here's our air bill or whatever it is. This is the one-time fee or rate that we may get for an interaction. But then we go, okay, well, is that person only seeing you one time? What is the lifetime value of that customer? Especially something as like simple as primary care, like that one-time visit could turn into 10, 20, 30 years of loyalty around you. It could go into, if you're a multi-specialty, it could go into intro referrals to go, okay, that's kind of a misrepresentation. If you're only looking at, oh, this person came in and had one interaction with you, and we're only placing the value as that one interaction. And the reason why that this is so difficult is systems like EHRs are not business analytics tools. It's always so common that people just go, well, I can't get that answer because it's not there. And it's not that you can't get the answer, it's just the tool that you're using is not meant to give you that answer. So the data is in the system, and very often you just have to bring it out of it, and someone has to look at it and analyze it for that use. And this is probably one of the primary ways that we look at billing companies as partners of ours, is you can come in and often be way more informed around the kind of financial metrics of your client's business, especially kind of lifetime value of their patients. And I use this illustratively, and it's very, very kind of simplified version, because I understand that you could have multiple codes for an interaction, especially from a surgical perspective. I understand there's facility fees, even anesthesia fees that come into play in this, but we're taking a very kind of like stripped down, simplistic view of this. Is a very common example, and you'll see the lens throughout the conversation, is an orthopedic brand. They'll have 3 different service lines and many times more, but when someone inquires, you may not explicitly know which service line they're engaging with yet because you don't know the severity of the problem. So we break down and go, okay, physical therapy is a service line. Here's a CPT code that bills in 15-minute increments. I used Fair Health Consumer, if you know it. I think it's kind of publicly accessible and known within the space. I plugged in my zip code here in New York, the heavy outer network place. So I understand the dollar value can change, but I'm just using outer network illustratively. You go, okay, that's a one-time value for a PT visit, where you may have that information at hand, but the big thing is you may not know how many average visits then someone comes. And that's a huge difference from an advertiser and what we're willing to spend for a cost per acquisition or even a budget recommendation when we don't know how many visits or what really the lifetime value of someone coming in is. So you as the kind of billing data, we can easily then dump that out and go, well, okay, we have the one-time value, but how many times does on average that person come in for that service line? That becomes a very different equation when you look at the lifetime value of a PT patient. And you take the same methodology, you look at something that's kind of like the next step in invasive treatment, like a trigger point injection, another associated code, the out-of-network billing rate. Again, I just use myself and the zip code I'm in New York illustratively. An example that this is a real client for us and the amount of visits that someone comes commonly for injection series, what that patient value is. And then again, kind of further escalating, we used, I think it was outside the knee surgical repair code to go, here's an out-of-network reimbursement. This becomes the kind of foundation, not only for many different uses in your own business, but data that then goes to the marketers. And you'll see as I roll down this of how we then as marketers can use this data.
For those listening, Bryan, I just want to go back to that last slide. So what Bryan is saying is that a physical therapy, the lifetime value of that customer, or you call it the per patient value for a PT visit, could be 2,500. A trigger point injection could be $8,000 of a patient value, and then a surgical repair could be $12,000 on an out-of-network procedure. So Bryan, what you're trying to say is that figuring out what the value of that patient is and how much revenue that patient is going to generate for the practice is important to understand when you're going into a marketing conversation, to know how much do you want to spend for a lead, like a patient lead. Is that correct?
Correct. Yeah. And we'll peel that lens back, and we don't dig it into it completely in this webinar, but you should then even have data of how many patients kind of move between service lines as well. We're just looking at it isolated in the moment of assigning a lifetime value by each service line, just so we get this conversation a lot of when is it appropriate to start is also a conversation of, well, how much should we put in even as well? And that should be understood between each service line, where the very obvious is we should be a lot more willing to spend around terms that are surgical in nature than they are PT in nature. And then especially if you even have that kind of cross service line referral data, it wouldn't be wildly difficult to digest and go, for every 10 PT patients, we on average actually end up having a surgical patient 1 out of 10 times. That's just another metric to go, okay, that'll bump up the lifetime value of that PT patient. And that's really like almost the reverse is like, if you don't have a marketing company that's asking these questions, then that's a problem too. That if you're just spending and acquiring for acquiring's sake with no concept of the value behind it, that becomes a kind of big blank void.
Okay, thank you, Bryan, for explaining that. And for all those billing companies that want to try to convince their clients to do some marketing, I think it's valuable for the billers to be able to provide this information with a simple reimbursement analysis, right? You could extract this information from most practice management systems by looking at certain CPT codes and looking what the average reimbursement is. It should be pretty simple to figure out.
Yeah, it's a funny thought that I'm even jumping ahead a little bit, but data is thought in so much in silos. And that's just my background's more in information systems, that like people think about data in silos so much that it was almost a surprise when we started to ask billing companies, this was 15 years ago, kind of for this data, where it was very thought as this kind of like linear episode of care that, okay, the billing happened and that's post-care, it's done, it's kind of like sits in this data vault after care that really has no value once you bill. And for us, it was like, well, that's like the entire gold mine around the finances of this practice. Like, why would we not be using that to then go backwards and inform marketing, really inform many different aspects of the business? I always put this in just as like a little bit of a rate limiter to just go like, as people start to understand this concept and they do this analysis, we often then get this like, oh, great. Like we know the finances about our business now. Like, let's just spend $1 million and keep at that ROI, keep running. But for us, obviously the simple thing to think about is like, we can't force people to search more than they do for the terms online, which translates into like, there's only a certain percentage of people in market for the care that you're giving. And as marketers, it's called the 95-5 rule. Is a very generalized kind of non-healthcare rule. But we did an interesting study, and I have to give credit to a partner company. Prairie Dog is a big healthcare advertising and branding company that their founder gave me this data that in healthcare, it's almost like the 99-1 rule, or even further down, this kind of like 99.9, that when you think about any one of these specialties, and we've been talking about orthopedics, is for every 100 people, there's only 0.5 in market around this. So it's always that concept, especially they think there's this like limitless side once they start to understand this, that just to temper kind of the other side of the expectations is like, there's only a certain amount of people that are in market around your specialty. So always just kind of balancing that equation as well, is that if you start to kind of uncap and spend a lot and kind of come in and go, well, we have an unlimited budget, that doesn't mean that there's unlimited demand. This is another simple kind of back of the napkin calculation that we always then encourage if it's still in companies. And a lot of times with companies we work with, either sometimes you have an operating or have the data from like a call center perspective. But even this is something that can be very simply kind of manually calculated, is what is your conversion rate? And that means a lot of things, but it's the very simple concept of how many inquiries are you getting? How many then pass clinical relevancy, geographic relevancy, financial relevancy, and then come in as a patient? That's a metric that we very often find is not informed or known in a lot of these healthcare brands. And I'm not saying that this is a perfect number, but even just a blended estimation around what we find a lot, even in the New York market, is roughly, I think it's about a 30% density of out-of-network benefits existing. So obviously not every inquiry is going to come in and be a patient. And that's a concept, especially within marketing, that the word conversion is always shown in like a Google ads or a Facebook ads, but that does not mean that they came in as a patient. And that's really a core area that you really want to press in any kind of advertising. What number or what percentage of these inquiries is really what we call it, actually converted and showed up into patients. And having that kind of blended number really becomes important, especially from a forecasting standpoint, to just go, okay, you'll see in the future slides, we can actually present the amount of projected inquiries, and then based on your conversion rate, you can set down a target going, okay, this is the amount of actual patients that we're hoping to get with this campaign. And following that lens, once then working through the billing data to understand service line values, patient values, lifetime values, having an understanding around conversion rate, kind of any good marketer that can cut their teeth should be able to also do preliminary research around your specialty and your location, and actually project an idea on budget, and even project an idea on conversions. This is a public tool built within Google Ads keyword planner. We just followed kind of the example of what we've been doing around this orthopedic brand, shoulder specialty, and shoulder surgery. We just picked a few illustrative terms that these are actual keywords that people search. I picked the New York market again, just to give an idea around the volume of these searches on a monthly basis. And then you can assign a budget. So this is showing that, okay, with a $1,600 budget, they're projecting 24 conversions. The giant asterisk there, again, conversion to us and any kind of good marketer is inquiry, not actual patient seen. So this is where then, again, it's a very simple kind of back of the napkin calculations that you'll start to see around how do we start to predict even the number of patients. On a quick aside, I always like to bring this up as kind of just a fun little thing that we were talking about keywords before, that a lot of times we've been talking about ICD and CPT, that the kind of like business and language of healthcare is wildly different than the consumer language of healthcare. While with this conversation, I'm trying not to dig too much into like the ad side of the interface, I do always like to just call out like the core language difference. And we'll always kind of make a joke and we'll go like, which one of these is the word cloud around the ICD and CPT codes for this particular procedure, and which one of these is the word clouds of the consumer keywords that were searched that brought them in for this care. And I think it's probably like blatantly obvious that the one on the right, there's only about 16 different variants of how you diagnose or bill for what's a septal perforation, which is just a hole in your nasal septum. On the left, we mapped 1,700 different consumer variants around, just like we said, simple symptoms and conditions, keywords that brought people in for this care. So we always really like push that concept again. It's like your marketing company should really be bringing to the table the language that you're then bidding after. This is where kind of the meeting in the middle of all these partners is great, where the data you have is wildly informative from a financial perspective, but all the language within ICD and CPT is not informative from an advertising perspective. So that's where then obviously there is certain limitations. So this is where then the marketers should meet you in the middle. Kind of going back to that example, it becomes a simple calculation that if we're projecting a budget of $1,600 for 24 inquiries, and I always say not conversions, inquiries. If your conversion rate's 40%, approximately 9 new patients, we took the average service line value. So that example before of PT, trigger point, and then shoulder surgery, when someone's looking in, we can't tell immediately kind of what level of diagnosis or kind of like severity of care that they're going to need. So we just took an average of those and go, okay, we can actually now start to predict revenue. And I put obviously an asterisk there is like, there's a lot more costs associated. It's not just the advertising budget, the advertising agency, well, we have the management fee, there's other upfront work around like building the website and tracking and all those things. So, but again, just a really simplistic kind of illustrative example of this is all still preparation. This is still just forecasting. This is using the existing data that you have access to, partnering with a marketing company and really putting down actual dollars and cents before you start diving headfirst into spending dollars and cents. I'm going to flip the script a little bit from kind of the preparation from a data and finance perspective and talk a little bit on the preparation from a marketing perspective as well, that you might go through this exercise and go, great, we have all this data, we've determined the value, we've understood that there's a demand within the market, we're willing to spend, but then we still kind of always pump the brakes a little bit and go, yeah, there's things that need to be in place too before you start just dumping advertising dollars. And this was to my earlier comment is healthcare is still a consumer industry. The simplest thing is a reputation that no matter the dollars you spend, inevitably after you say go after a keyword, they're going to then look up that brand or look up that doctor. They're going to want some validation that the quality of their care, the type of care that they've received from past patients. And the way we look at that is real estate. Is like a search result is just an opportunity to own the real estate and promote yourself. So making sure you have many touch points around a positive reputation is going to have a direct effect on the effectiveness of your ad spend. The number fluctuates a little bit, but we always see somewhere between about 4 and 6 website visits or digital touch points before someone reaches out to you physically. So we look at that as you kind of have this 24/7 online sales agent functioning before you even have a chance, an opportunity to defend yourself physically. So you want to make sure that that reputation, all those touch points are in a positive light so that you don't give a potential consumer or patient an opportunity to drop off before they even reach out to you.
Brian, could I ask you a question about this? Are they visiting your website 4 to 6 times, or are they going to 4 or 6 different websites before they choose which ones they're going to call?
We call it digital touch points. So it could be a mixture of your site and other sites, but it for certain is not just your site. They're looking for some third party validation. One of the biggest in the kind of gorilla in the room is Google My Business, that listing on the right hand side, that when you're a physical brick and mortar space, this is a profile associated to that. We have a tremendous amount of data, like the double-digit percentage amount of patients that come just from Google Business listings. But we look at it as kind of the big players in the room. The obvious ones are like ZocDoc within healthcare. That it's kind of a whole nother conversation. We could talk about them specifically, but depending on your specialty, if you're like more aesthetics, there's different platforms. Even your geography is different, but really just as many as possible. That's kind of the way we think about it, is to own the real estate perspective.
Is that Google Places you're talking about? Google by Business?
Yeah, they keep
Google Places.
they keep rebranding it. I think it's called Google Business Profile now is the new term.
And is that free to do that, or do they charge you to do that now?
No, it's still free.
Okay,
You
great.
claim the listing. It's one of the like maybe side notes from like it's often an SEO conversation, but it has a huge effect on advertising campaigns as well. That your reputation there is something that either can get brought into your ads accounts, literally like you can sync your Google business profile to the ads account and showcase your reviews, or people are searching you after they interact with an ad. So you really want your reputation in the right place.
Okay, so let's start there. If for all those providers out there, and we have billing companies on the line, so you have lots of providers that you're consulting with, is to encourage them to create a Google. You tell us, Brian, what do they do? Because this is the free part of it, right? Claim your business. Tell us how to do that.
Yeah, I'm 99% sure the new term is Google Business Profile.
Okay.
You can Google that and it'll open up an account. More than likely, you already have a profile. In essence, like as soon as you, especially as a provider, once you have an NPI, and then once you have a physical address, a lot of these profiles start populating automatically. So you advantageously want to get access to update the information so it's correct, and then proactively work to gather reviews. So 100%, I mean, 15 years in, still the same recommendation. Its names have changed or its functionality, but it's the same thing. Claiming the free profile, owning it, updating the information, proactively reaching out for reviews.
Thank you.
To touch a little bit just on the advertising side, this is kind of a point that we see dropped a little bit, is making sure that you're tracking every possible entry when you start running ads from a conversion standpoint. It's very common, and we see it anywhere from 30, 40, upwards of 60% of inquiries are still phone based within healthcare. That you may be spending $10 and reporting 3 conversions, but if you're not properly tracking all potential entry points like calls or chats or forms, you're literally misattributing the value of the advertising spend or under attributing the value. So really working to kind of plug all those gaps to go, okay, when I spend that dollar, am I able to track then any digital to physical interactions and start to properly attribute the value to that advertising spend? There is tremendous amounts of resources online around these, and I'm steering a little bit less away from like ads best practices and analytics best practices, but I'd be remiss in not calling out that you're looking to take someone into physical care. So we have to be able to track as many of those actions that they can take so that you can start to have some measurement of effectiveness on your ad spend. And that's even an example too. I don't know if you can see my cursor, but where it says New York, New York in the ad text from New York Presbyterian and then 9 locations nearby. That's your Google business profile. So when you have them set up and synced, you can actually then pull them into your ads campaigns, and it gives your ads campaigns even more real estate because now it's populating your business profile listings as well. Another one of those, like, I'd be remiss to at least not as a marketer touch upon this briefly, but we talked about all this preparation and analytics, and at the end of the day, you're sending this traffic to your website. Like your website still drastically matters. You can do all this data analysis and preparation, but if you have non-responsive kind of old website that doesn't work on mobile, if you're not thinking about the information that potential consumer or patient wants, all of that kind of goes out the window as well. So again, a whole nother talk and a ton of resources on this, but we always like to just kind of do it real briefly. Of it's another kind of consumer's perspective is people want to see that, yes, you treat what they're potentially looking for. That's care. They want to see geographically where you are they in your market so that if they need to come and see you, they want to see the providers and the specialists around, especially if you're a specialty care. They want some third-party validation around reputation and review, and then a call to action. It's like a kind of very simple landing page topic, but again, has like tremendous resources, but we had to be remiss not to at least touch on this topic briefly. It's a conversation we get a lot too, of even timing. That this is another thing that we love, that it's kind of what we call it kind of like the lazy consumers mentality. That this represents, we have this like huge database of when people make appointments or inquiries for care across kind of all the web platforms that we control. There's hundreds of thousands in there at this point. And you look at this and you go, it's really funny. The primary days of the week and times of the day are Monday and Tuesday, kind of 10 a.m. to 3 p.m. And the easiest way to think about that from a consumer's perspective is like, we're lazy. We don't think about our care over the weekend. It's not something that we want to when we have our downtime. So Monday rolls around and you're at work and you go, oh, okay, I should call that doctor. I should make that appointment. And it's usually prime within your working hours. I'm sitting at my desk where I have the downtime to get on chat. There's a lot of things that can be gleaned from this. From an advertiser's perspective, we may be willing to spend a little more money because we know there's even higher volume around search within that. From an operations perspective, can you handle that inquiry? We give this data a lot to call centers to just go like, can you handle the influx on these Monday and Tuesday mornings when we know that it's coming in there? Or do you have the fail safes or the triggers in place to handle this as well? So we always like looking at this. It's fun kind of consumer data to kind of always reinforce that healthcare is no different. And inherently people are kind of a little lazy around it. So it makes sense kind of why these things happen, especially kind of earlier in the weeks and during the daytime hours. On the flip side too, we get this a lot, and this is very, very specialty specific, but there can be massive seasonality trends. And I used kind of 2 examples to be jarringly opposite of, we've been talking about orthopedics and ACL, where if you look at, this is Google Trends, again, which is another public tool. It's a great product to kind of play around with, especially from a healthcare trend perspective. Is this looks at a year's worth of data around how people search for these keywords. ACL surgery, you see kind of has minor bumps in the run, but generally the volume is kind of equal throughout the year. Something you look at sinusitis though, and sinus infections, it can double in volume. That makes sense. And kind of right when the season we're in right now, even as a heavy kind of back to school, heavy flu season. So another lens of data to think about from the seasonality perspective of advertisers can use this from even increasing budgets seasonality wise, increasing budgets time of day, day of week. So a lot of different gleans around this of how to use this data, but it's a fun thing, especially based on your specialty, really dig in to understand these trends that can affect some of your projections and your willingness to spend. In summary, it's a funny concept that I think we can almost bandwagon onto, is within the care delivery, people are trying to break down silos, like you should be seen by kind of multi-care providers. But we push that concept more. I think that was kind of the summary that hopefully that was taken from this call, is even kind of the administrative or business side of healthcare has data within silos that can be very useful throughout. And the core around this conversation is the billing side, is that that information is wildly informative from a financial standpoint, wildly informative from a language standpoint. So really think about how to leverage that and how to bring value, especially as a biller or a billing company, to your practice or your clients that may not traditionally be thought in being useful outside of that. Some of the just kind of quick takeaways is the summary from this as well too, is use that billing data to help create an average patient or service line value. Even if that's a fixed number that you review quarterly or yearly, because benefits can change, it's wildly informative. There's ways, and this was maybe the more kind of back of the napkin basic to get that to even where it's very dynamic and almost real time. But start in a simple kind of back of the napkin blended service line or patient value. Establish a conversion rate. And again, even if that's a fixed number that you're reviewing quarterly or yearly, just understand how many inquiries you get and then how many are actually relevant. What is that percentage? Those are two core numbers that any advertising campaign should be using to leverage before launching. Reputation, reputation, reputation. It's a core thing we even say as advertisers, is that the one thing that you take with you, even when you're not engaging an advertiser, is it has an exponential effect of paying off from you from a kind of evergreen standpoint, that not only should you have a positive reputation before launching an ad campaign, it's something that you should consistently be doing. There's kind of this infinite mentality that doesn't end. And then forecast. Sit down with actual budgets, actual projected revenue, actual projected patient volumes before you run, and ensure that you're tracking. You want to make sure that you're attributing any potential conversion to every dollar that you're spending. I think we open up a little bit. I don't know if Connie has any set questions or any questions from anyone, but we appreciate the time. Hope it was informative as well.
This is wonderful, Bryan. Thank you so much for sharing your knowledge. I mean, really some great takeaways. The conditions that people search for, conditions and diseases, I think is great. The Google Places, I think is great. And it's interesting that they do 4 to 6 website visits before they reach out, which I think is also very interesting. But so thank you for all of that. I'm sure everyone has a lot of other takeaways. For us, I would say a great way to get in with a new client is to always offer a free AR analysis. And we have an AI tool that we use where you give us a chunk of claims and we run it through our AI tool and we come up with some great numbers and metrics. So that's a great value add if you're trying to land a client. And Bryan, I'll hand it over to you.
Yeah, and similar with the same data and how we work with a company like Connie's or billing companies in general, is that data we can then use once you have an understanding of the patient value to then forecast, like kind of answer that question, is when is it time to start an ad campaign? Is you may have the value, but we want to make sure the demand is there and that it's profitable. So equally with that same data set, if anyone has questions or would like to inquire to understand how we use that, and let us run a keyword and conversion forecast for any of their clients, or we'd be happy to.
That's awesome. And Bryan, I think for us as billing company owners, I think there's a lot of frustration in the physician side of the billing, right? We could only collect so much from the insurance companies. And then we're almost like, okay, there's not much we could do except for the doctor to see more patients. So how do I get more patients? Marketing, right? But I think the medical billing companies are in a position to be a consultant to the providers. They have the trust of their clients. And I think, either referring them to someone like you is great. But even just to start off, have them claim their Google Place, like their Google by business, right? That's a first easy way to start. And then the billing company kind of being that liaison between the physician and the marketing company. The billing company has the data that you guys need to figure out how much they should spend, right? So I think it's a great partnership for us to all work together. And I'm so glad that you came on. We'll open it up to any questions. So if anybody has any questions, please drop it on the chat, or we could figure out a way to unmute you and you can ask the question out loud. So, Paul, I'm going to let you see if there are any questions that are coming in. Let's take a look quickly. And if not, you could always reach out to Bryan. I'm sure, Bryan, you are just such a giver in the space. And so if anyone does have any questions, Bryan, do you have a screen with your contact information, or you want to share that with us? Wonderful. Oh, beautiful. Love it. So Bryan's company is titlehealthgroup.com, and he's in Manhattan, in the hub of it all. Thank you so much, Bryan. I really appreciate your time and sharing your knowledge with us.
You as well, honey. It's always a pleasure. Thank you.
Okay, and to all the people that attended, thank you so much for sharing. If you're on the East Coast or lunchtime with us, we appreciate it. And if you found this valuable, we'll send out the recording, and feel free to share it with whoever would find value in it. Thank you so much, Bryan.
Have a great day. Thanks, honey.